this paper we critically reflect on a somewhat unexpected policy outcome, where a large multinational corporation, one frequently blamed for exacerbating childhood obesity, is now officially sanctioned and endorsed as a provider of school-based obesity solutions. So we examined two such solutions. One is Energy Balance 101, a resource from the US, and the other is a physical activity and health education program called Step With It Singapore, from Singapore. These two programs, despite their different contexts, had a number of similarities. One is that they positioned all children as being at risk of obesity. They also reproduced the idea that health was mostly about balancing energy in with energy out, and they also conflated notions of health with body weight. Both programs made use of pledges and contracts to make children commit to being healthier, to eat better, to move more. And they also encouraged children to monitor, evaluate, and even confess their own healthy and unhealthy eating and exercise behaviours. Now, even though Coca-Cola officially acknowledges the multiple and complex determinants of obesity, these school-based solutions were relatively simple and ultimately worked or attempted to make children more responsible, if not wholly responsible, for their own choices, health, lifestyles, and bodies. There were some instructive differences between the two. One was how they formed partnerships. So for Step With It Singapore, they had 4 partners, 2 of which were large government departments. However, for Energy Balance 101, this was a program made possible through the Healthy Weight Commitment Foundation. And this foundation is made up of over 200 for-profit and not-for-profit members, of which Coca-Cola is just one. Now, there were also some noticeable differences in the branding strategies. Energy Balance 101 had no logos or no products of Coca-Cola. However, Step With It Singapore, the instructors' t-shirts, the free equipment given to schools and to students, and even the children's workbooks were all saturated with the ubiquitous red and white Coca-Cola colours and logos. Now, the most obvious point to make about these two initiatives is the way in which Coca-Cola's financial interests have evolved to coincide with the interests of governments, of public health organisations, education departments and schools, and how schools and concerns about childhood obesity have been used to reshape the very idea of health and education. Now, while we can only speculate about the harm that these simplistic and individualistic health messages may do to young people, these kinds of programs strike us as both unethical and dangerous. They represent not only the radical dumbing down of the possibilities of school-based health education, and therefore do a disservice to children, but they also represent a new battlefront in the neoliberal takeover of public schooling. So watch this space.